First of all, I just want to thank everyone for joining. Deepika has been working really hard on this presentation, and so just to give you guys a little bit of background, in case you're not familiar with Deepika, she's had quite the journey. She is a neurologist originally from Kansas City at KU Med, and um, after having 5 years of experience as being a neurologist, unfortunately, Deepika then suffered from a stroke in which she came through our doors at QLI. So that's where maybe some of you have recognized her. She came through our inpatient program and worked with a lot of the team members here. And then after that, she went back home to Kansas City, where we started doing tele-rehab therapy with her, and still doing rehab with her. And she has made tremendous progress. I think not only physically, but mentally as well. And from an emotional standpoint, I think, Deepika, you've come so far. And we've all just been so excited to see how far you've come and where you are going. And so this idea kind of stemmed from, we were working on obviously doing more functional speech. We were going through research articles, and we were going through all kinds of different things to try to get you back to being a neurologist. And the idea came and that maybe we should look at doing motivational speeches. And so then we started typing up just a random speech that you could use in any kind of context, whether it be motivational or informative, and just pulled John in, knowing that he has always the greatest ideas.
Mm-hmm.
And so we were talking with him, and he said, well, why don't you guys do a huddle? And so we said, well, that's a great idea. So I convinced Deepika, maybe unwillingly a little bit, to do huddle, to do the huddle. And so I'm just super excited that she was willing to do this and to push herself a little bit. And so yeah, I'm excited for you guys to hear her. You guys can go ahead and put some chats in the chat box if you have any questions or comments, and then afterwards we can go ahead and you guys can ask whatever questions you have for Deepika. And just keep in mind that she has some family joining, so any other comments you might have, just be mindful of that as well. So yeah, go ahead, Deepika. You can take it away.
Thank you, Neely. Thank you for the wonderful introduction, and a big thank you to all of you for taking out some time for me. And as Neely said, that yes, I've been thinking of sharing about my life's story and the lessons it taught me. And when John gave us the idea of talking in front of you guys in the huddle, I was excited, but like Neely said, I was unwillingly excited. But yes, I mean, QLI and all of you guys have been an important part of my life since November of last year. Wow, it's gonna be almost a year. And most of you may know that why or what got me to QLI. So just taking you guys back with me a couple of years and sharing my life's story. So here we go. So it was September 24th, 2019, my day off work. And as Neely told you guys, that I work as a neurologist at University of Kansas Medical Center. I decided to pamper myself and go to a restaurant for a nice brunch. Now, this is unusual for me because I don't usually eat in a restaurant all by myself. So as you can see, the picture, here's the picture of the food I went there for. And this also, again, goes to show that it was how unusual it was for me, because I mean, I ordered food and then took a picture of that food. And I was enjoying my food, enjoying the music, when suddenly I had a bad, terrible headache. I checked out from the restaurant, went to my car, and texted a friend. That's the last thing I remember. The next thing, what I remember is about a week later, I woke up in a hospital room on the same floor where I see patients. and in a green gown. Wait, why am I wearing a green gown? And why is my brother there? Those were the first questions that came to my mind. I was like, my brother didn't tell me that he's going to be visiting me. So why is he here in my hospital room? And why can't I move my body? Why can't I understand what my brother is saying to me? Why am I having so much difficulty talking? That's when I realized that I'm not the doctor here. I am a patient. I've taken care of hundreds of stroke patients, but here I was suffering with a stroke. The stroke had left me completely weak on the right side of my body and with significant speech and cognitive problems. Going back a few more decades, I was born and raised in India. Growing up, I always wanted to become a doctor. I remember saying that when I was a fifth grader. So after high school, I spent about 15 years to fulfill my dream. And this included relocating from India to US for my neurology residency. Moving to a new country was the most challenging experience, but I was blessed with very helpful and welcoming people both at work and around me. In 2015, I finished my neurology residency and fellowship and got a job as assistant professor of neurology in the same hospital, University of Kansas. It was like a dream come true, a dream that I had since childhood. Could life be any better? But in 2018, I was diagnosed with stage 4 colon cancer. Suddenly, the terms cancer, metastasis, chemotherapy, prognosis, all those medical terms that were used by me on my patients, they started to sound different. They were about me. But fortunately, I had great support from my family and friends, amazing support from my employer, and an excellent panel of doctors. All that gave me the strength to deal with this. As expected, next 1 year was full of ups and downs, both physically and mentally, but it went by pretty quickly. I was back up with a new life and a new body, recovered from cancer. It changed my outlook towards life. Rather than worrying about small little things, life meant for living fully. Don't give up. Always have faith. Do things that make you happy and pamper yourself. Here's my picture after cancer recovery. So this is the picture at the cancer hospital. Uh, this ceremonial task or whatever you want to call it was introduced by MD Anderson. I think MD Anderson Cancer Institute in Texas. I think back in 1996, where all the cancer institutes they have a bell. So whenever a patient is done with his chemotherapy or radiation therapy, he or she gets to ring this bell. So that is my picture from the day I was done with all the cancer treatment. And okay, so I was back to work, taking care of patients with strokes, seizures, and other neurological disorders. Life was great again. But little did I know that I was going to be back as a patient in a few months, and this time as a neurology patient. I was in the hospital this time for 15 days, and my doctors were my colleagues and friends, the ones who had always seen me as a neurologist, but now they were seeing me like a patient. And like any patient, My day went by with nurses taking care of me, checking my vitals, feeding me, dressing me, my therapist trying to get me up and move from the bed and take a few steps, uh, trying to help me to speak a few words, checking my swallowing, and the doctors, they're checking my progress. All my colleagues and friends used to come and visit me. After these 15 days of hospitalization, I was discharged to an inpatient rehab hospital. And then, after spending 40 days at this inpatient rehab, then I came to QLI. That was end of November 2019. So, from someone who had referred hundreds of patients for therapies, I had now become one of those patients. I have little to no recollection of the first 2 months. Uh, my brain's ability to process and analyze information was significantly affected. But with time and with therapies, I had some cognitive improvement and was able to understand the extent of the disease or the injury. That's when I started thinking, will I ever be able to walk again? Will I ever be able to live independently? Will I ever be able to be a neurologist again? What happens if I don't recover? What's life gonna be like? I was so frightened. I had transformed from an optimistic and a hopeful cancer survivor to a down and a depressed stroke sufferer. I lost all my strength and positivity that the cancer had taught me. I lost all hope. Honestly speaking, the thought to end my life came to me, God knows how many times. But the support of my loved ones gave me the strength not to do that. As time went by, I continued with all my therapies. I had the same questions that my patients used to ask. What are my chances of full recovery? And how much time is it takes to recover? The difference is this time I was the patient asking those questions. The neurologist in me knew the uncertainty of the answer. But as a patient, this was so distressing and disturbing. That's when I was actually able to feel what my patients go through. That is when the statements I used to say to them, hang in there, you are doing great, or I can understand your frustration, but don't lose hope. They all seemed so insignificant and hollow. Now I can truly understand what my patients uh, went through because I am living through it. And being a neurologist, I used to enjoy discussing neurology topics with my therapist. And that's when I was reintroduced to neuroplasticity. I knew always what neuroplasticity is, but now I was experiencing it. So, what is neuroplasticity? I'm sure all of you probably already know what neuroplasticity is. But as said, it is the brain's ability to regrow new neurons and reorganize synaptic connections, especially in response to learning or following an injury. Or, in simple words, it is the brain's ability to recover and relearn all that is lost in an injury. And with extensive research is done over the last few decades, now we have a better understanding of how it works on strengthening physical, cognitive, and emotional well-being. And they say that repetition is the key, but this is not just 15 or 20 repetitions that like we do in the gym. It's about millions of repetitions. So here I was, and I'm still training my brain to relearn the basic necessities like how to walk and how to talk. I still remember the first day when I was able to move my leg. Let me show you a video. So this is my uh, video from the acute inpatient rehab hospital. Uh, and this was the first day ever I was able to move my leg against gravity. And here's a video or a picture of me taking the first few steps, holding onto a cane, and uh, the therapist is holding me with the gait belt. And the next one is, and here what I'm doing now. This is how I'm walking now. And for this, a big thanks to Brad, Melissa, Megan, sorry, and Melissa also, of course. Brad, Megan, and Christy. A big thanks to them. So, and likewise, I had severe impairment of my speech. I had a hard time trying to get the words out, understanding what people are saying. I had to relearn whatever language skills I had. From someone who had so much trouble speaking, here I am sitting in front of you and giving you a talk. Thank you for giving me this opportunity. It's a major milestone in my recovery. Thank you, Jen and Neely. Besides all the psychological symptoms, brain injury, besides all the physical symptoms, brain injury, or rather any injury or sickness, can cause psychological and mood disturbances. And I was no different. I actually lived through the stages of grief. At one point, I was in denial, without realizing the extent of the injury. And then came anger and depression. And just 2 to 3 months ago came acceptance, where I finally accepted the fact that I am fighting a brain injury and I'm going to win it. I'm going to win. I'm going to get my life back. The biggest change I noticed was the change in my insight. We all have a habit of comparing ourselves with our own selves. The point is, which self are we comparing with? I realized that I always was comparing my current status with my status or how I was before the stroke. That made all the progress look so trivial. But now I'm comparing it with myself after the stroke. And that helps me to appreciate all the accomplishments and the tiny battles I fight every day to get to where I am now. Today, almost about a year later, I have evolved from a paralyzed and bedridden person to someone who's walking around independently, from a completely dependent person to someone who can live independently, from someone with significant cognitive and speech problems to someone who can be a neurologist soon. Emotionally, also, I am in a better place. I'm smiling again. I'm enjoying life. I'm hopeful and I'm thinking clearly and have new goals for my life. I'm happy again with this new life and this new body. These experiences have taught me a lot, and I still have more to learn. And someone has rightly said, life is so ironic. It takes sadness to know what happiness is, noise to appreciate silence, and absence to value presence. Thank you.
Thank you so much, Deepika. I've heard that so many times, but I get goosebumps every single time I listen to it.
Thank you.
That was amazing to hear your story and how far you've come, and I'm sure everyone else feels the same way. Does anyone have any questions or comments that they would like to ask Deepika while she's on here? Pat, thank you.
I might just unmute and ask a question if that's okay, Neely. Yeah. Deepika, thank you so much for sharing. That was so powerful. And thinking back to your comment about, the encouragement that you used to provide your patients as a neurologist, and then being the patient, really how that impacted you. I'm curious, I guess more for advice for all of us, if anything, but I'm curious how in the future your experience will change how you encourage or how you encourage your patients and show compassion, and how that might translate to advice for any of us.
So, I to be honest, I thought a lot about this point, Pat, and I think the time I spend with the patient and how much I talk to them, the medical part of it is gonna stay the same. I think what I'm talking to them about, the non-medical, the emotional support or social, that part is gonna increase. I mean, just like I mentioned in my talk, that the non-medical part earlier was hang in there. I mean, but now it feels that, was I just saying the term hang in there just for the heck of it? No, I mean, I don't think so. I was sympathetic, but not to this extent. So, I mean, one of the way would be what I think right now. I mean, I can definitely give them example. I mean, my life's experience, and that might help them that, okay, if a person sitting in front of them is back to life, she is a neurologist again and practicing, and she's recovered from a stroke. So maybe that might give them some courage to work hard. Because, I mean, being in the therapies, I mean, it is a lot of hard work. Now I can actually understand why our stroke patients, they don't improve, they don't want to improve. Or, I mean, it's not that they don't want to improve, I should take that back, but it is very hard. It is a lot of work. So, I mean, I can definitely understand all that better. And I'm not gonna be, I mean, I don't know. I mean, I'm just gonna be like more understanding of my patient's life.
Thank you. Thank you for sharing.
Oh, thank you.
Deepika, I know you from being a doctor, and you'll probably be the best doctor for people with who've gone through this journey. What does that look like for you when it comes to getting back into the medical field and practicing?
So, I mean, honestly speaking, I am pretty nervous of going back to practice. I mean, of course, I mean, I'm gonna go back to work and see patients, but I mean, I feel that our patients gonna accept me that, oh, this is a neurologist who's had a brain injury. And I had the same conversation with my chairman also, my employer, that a patient can raise questions that, oh, this doctor has had a brain injury. So, but what I was told by my employer, that no, none of them are going to have this question, none of them are going to doubt you. They in fact are going to be more optimistic or more leaning towards seeing you, because they'll feel that this is the right person for us, because she can understand our journey, our our life better. So I mean, yes, I mean, so from if I that made me think that yes, that's true, and that actually gave me the idea of maybe with my life experience I can create some awareness, just not in the patients but in support groups. I mean, I'm going to be seeing just a few patients a day, but in support groups, if I can help thousands of patients, that's that's probably something that I'm looking forward to.
Deepika, great job. That was very, very impressive. And I have the benefit of seeing the very, very first dry run that you did, and you've already refined, and it's already improved from just a couple weeks ago. So this is really impressive. And I know one of the things that you did keep in that I remember being struck by, it was a very profound statement that I was trying to write down the first time, and then I missed it again this time, but you were talking about, and I wanted to get the words exactly right, but I just thought that this was such a great statement about, you talked about the contrast between going from an optimistic cancer survivor. Could you give me that line again? Just because I just think that's so good.
Yeah, so I said that, and that's actually true. I realized that I was transforming from an optimistic and happy cancer survivor to a down and depressed stroke sufferer.
I just was struck by the two terms, survivor and sufferer, and then obviously the contrast in the emotions that you were feeling. And it sounds like the recovery for the stroke from an emotional standpoint was much more difficult. Is that fair to say, or am I?
Nope, absolutely right. You're absolutely right. And probably because with the stroke, of course, I mean, part of it is science again, because strokes, they affect emotions also. And but the other part of it is that I've seen so many people with strokes. I mean, I'm their doctor. I've treated the stroke, but here I am suffering with that disease. So that is what caused more emotional or mood disturbance.
That's really interesting. Had you been an oncologist, maybe the tables would have been, maybe things would have been reversed. That's really interesting.
That's true.
Okay. Yeah, thank you. I wanted to make sure that I got that down because I was really struck 2 times by that. So.
Oh, thank you.
You're welcome.
Deepika, hi. I just wanted to
Hi,
say
Jimmy.
hello.
How are you?
I'm good. How are you?
Good.
Your story is just so inspirational, and it's just so great to see you. Kind of left abruptly from Omaha, and we all miss you.
I know.
So just wanted to let you know that, and you are the hardest worker, and we all learned a lot from you. So I hope you know that all of your team just continues to learn from you. So it's great to see your progress. So I appreciate you doing this.
Oh, thank you. Thank you so much. I still miss you and all the virtual reality games.
Yeah, I know. I was worried you were going to tell the story about your fall with me on virtual reality.
Oh.
But you kept getting back up, right?
Yes.
Yeah.
Deepika, nice job. Thanks again, like Jamie said, for sharing your story. I just have a question. Besides medical and returning to being a physician, what else is next for you? So what other things are you looking forward to? When's your next talk? This is exciting for you.
So when's my next talk? That is gonna be a big question as to where, how, I don't know. I mean, all this was just it's just an infant, the idea. So yeah, I don't know. But otherwise, except for going back to work, where I was in life, I mean, literally touring a lot of places, hiking, this and that. I mean, So I would want to get back with that. But well, thanks to COVID, I cannot do that. I mean, no one can. But yep, so first thing first, getting healthy, then back to work, being a neurologist again, and 3, getting back with life, doing activities or things that I used to enjoy, pampering myself. Pamper yourself and always keep hope and have faith. And then obviously, and share my story with others and try to motivate others. If I can, if I can maybe give courage or positivity to a few patients, few people, I'm gonna feel grateful for that.
Well, I think we would love that. You've also been, I don't know how many people know this, but you've been super helpful to quite a few individuals on our campus. So thank you for that and your words and wisdom and assistance.
No, thank you, Melissa.
Deepika, I think we always learn from, you know, as a program, you know, and as people who are providing the services that you received once. When it comes to the inpatient time that you spent over here, looking back, I know you're very thankful that people, you know, worked with you. If there's 1 or 2 things that you could say, you know, if you did this in your program, it would be a lot more stellar. What is that? What is the 1 or 2 things that you could say, you know, here's some advice that I could give you?
Honestly speaking, I have no advices. No. So when I was there, I mean, physically when I was at QLI, I mean, you guys had exercises or classes all throughout the day. My day used to begin at 8:30 and used to end at 4 or 5 sometimes. And it was, I mean, physical therapy, occupational therapy. I used to have a session with Jacob for psychological improvement. And then in the gym with Spencer and Ed in the what is the name of the Ed's class? Oh, he's gonna be so mad. I forgot Ed.
Was it adaptive sports?
Oh yes. Yep. So I mean, it is just completely balanced. And then Sarah and Brandy, I mean, they used to take care of all the life skills, or I mean, so I mean, it's completely balanced. I don't think so. You can improve anything more than that.
Well, thank you for the compliment. We will still have you
No.
rack your brain and say, there's that one thing. Thank you, though.
Hi, Deepika. My name is Michelle. I didn't have the privilege of meeting you when you were here, and so I just want to tell you that I think your story is pretty remarkable. And you know, we talk a lot here about just being resilient and pushing through. And you said the word hope a couple times, but I think even just your willingness to be completely transparent and honest as you're sharing your story, I think is really powerful. I just kept thinking when Melissa said, gosh, when is your next time you're going to speak? I kept thinking, man, this is such an incredible teaching opportunity. So whether it be, you know, I think all of us are going to walk away with just having a greater sense of how we can show empathy and express empathy. But I think you have such a gift now to share with other physicians and other people in this world to better care for people that are, you know, after suffering a stroke specifically. So, but yeah, I just wanted to tell you, thank you. I think you have a really incredible story. So,
thank you, and I agree. I mean, but it took me 10 months to realize that. I mean, for the first when all this was happening, I was literally. I mean, just like I said, I was a down and depressed person, but now, I mean, I'm waking up, or yeah, I mean, I'm more positive now. So yes, it takes time, but I'm sure I want to be like this.